Today, we are going to discuss the importance of PCT and CRP in COVID-19 scenario. To begin with, let us discuss what is COVID-19. Coronavirus disease, that is COVID-19, is an infectious disease caused by a newly discovered coronavirus. Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East respiratory syndrome like MERS-CoV and severe acute respiratory syndrome like SARS-CoV. A novel coronavirus, which is called nCoV, is a new strain that has not been previously identified in humans. If we try to understand the structure of coronavirus, it is a spherical or pleomorphic enveloped particles containing single-stranded RNA which is associated with a nucleoprotein within a capsid comprised of matrix protein. The envelope bears club-shaped glycoprotein projections. Some coronaviruses also contain a hemagglutinin esterase protein. It is observed that most people infected with COVID-19 virus will experience mild to moderate respiratory illness. However, the older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, cancer, etc. are more likely to develop serious illness. In COVID-19, the most common symptoms are like fever, dry cough, and tiredness. However, there are less common symptoms, which is visible in many asymptomatic patients, like aches and pains in the body, sore throat, diarrhea, conjunctivitis, headache, which is very common for many tropical diseases. Even it is observed that loss of taste or smell and even a rash on skin or discoloration of fingers or toes are also symptoms of coronavirus disease. If it is observed that patient is developing the serious symptoms like difficulty in breathing or shortness of breath or chest pain or pressure on the chest or loss of speech or movement and patient is going to septic shock, the immediate step is recommended. For diagnosis of COVID-19, PCR assays and IgM-IgG combo test can be performed. There are other associated assays which are important for patient monitoring, like complete blood cell counting, chest X-ray, chest CT scan, D-dimer assay, CRP and hsCRP, as well as PCT. When a patient is infected with COVID-19, inflammation happens in the patient's body. Now let us know what is inflammation. Inflammation refers to body's process of fighting against things that harm it, such as infections, injuries, and toxins in an attempt to heal itself. When something damages body cells, body releases chemicals that trigger a response from body's immune system. Inflammation can be either short-lived, which we usually call as acute infection, or long-lasting, which we usually call as chronic infection. Acute inflammation goes away within hours or number of days. However, chronic inflammation can last months or even years. During COVID-19, the detection of CRP and PCT is of certain value to distinguish whether there was a bacterial infection in the lungs. These inflammatory factors may help to preliminarily evaluate the immune status of patient. Procalcitonin is a substance produced by many types of cells in the body, often in response to bacterial infections, but also in response to tissue injury. The level of procalcitonin in the blood can increase significantly in systemic bacterial infection and sepsis. CRP, that is C-reactive protein, is a protein made by liver. It is sent into bloodstream in response to inflammation. Now let us see how PCT and CRP helps in patient management. During antibiotic therapy, it helps to avoid blind or inappropriate use of antibacterial drugs, especially the combination of broad-spectrum antibacterial drugs. Both of these assays helps in treatment of septic shock by recognizing the possibility of septic shock. When the infection is suspected, they helps to monitor and urge precautions to be taken. Hence, the detection of CRP and PCT is of certain value to distinguish whether there was bacterial infection in the lungs or not. During uncontrolled inflammation of lungs, there may be substantial reduction and dysfunction of lymphocytes, and the adaptive immune response cannot be effectively initiated. The uncontrolled virus infection leads to more macrophage infiltration and further worsen the lungs injury. Meanwhile, the direct attack on other organs by disseminated SARS-CoV-2, the immune pathogenesis caused by the systemic cytokine storm and the microcirculation dysfunctions together lead to viral sepsis. Therefore, effective antiviral therapy and measures to modulate the innate immunity response and restore the adaptive immune response are essential for breaking the vicious cycle and improving the outcome of the patient. Jetin 1100 immunofluorescence analyzer. It performs PCT and CRP with multiple other associated assays like D-dimer, cardiac markers, etc. It is highly efficient and accurate. It performs the test in real-time basis and rapidly. It is very convenient in operation and it has a very user-friendly interface also. Jetin PCT and CRP assays. It offers the pack size of 25 tests with all the required kit components. Both the PCT and CRP has high sensitivity and hence low cutoff value. Plasma, serum and whole blood can be used as sample. They have wide measuring range and less reaction time.